How many times did you wake up last night to use the bathroom? Once? Twice? Maybe even 3 or 4 times? If you're nodding your head right now, you're not alone. Millions of seniors around the world are losing precious sleep because of frequent nighttime trips to the bathroom, and most think it's just a normal part of getting older that they have to accept. But what if I told you that waking up multiple times every night to urinate isn't something you just have to live with? What if there were simple changes you could make starting today that could dramatically reduce or even eliminate those disruptive nighttime bathroom visits? The truth is, there are specific habits and behaviors that many seniors unknowingly practice every day that are making their nighttime urination worse, and most people have no idea they're doing it. Tonight could be the first night in months, maybe even years, that you sleep through without interruption. The relief of waking up refreshed, having slept deeply for 7 or 8 hours straight, is within your reach. But you need to know what you're doing wrong first, and more importantly, what you can do right. Stay with me until the end of this video, because I'm going to share the most common mistakes seniors make that worsen nighttime urination, plus practical solutions that have helped thousands of people just like you reclaim their sleep and their quality of life. Getting up once or twice during the night to urinate might seem like a minor inconvenience, but for many seniors, it becomes a nightly struggle that affects every aspect of their lives. This condition, known as nocturia, affects up to 80% of people over 65, making it one of the most common yet overlooked health concerns in the senior population. The cycle often starts gradually and almost imperceptibly. Maybe you notice you're getting up once during the night, then it becomes twice, and before you know it, you're making 3 or 4 trips to the bathroom between bedtime and morning. Each time you wake up, it becomes harder to fall back asleep. Your body starts to anticipate these interruptions, creating a pattern that seems impossible to break. What's worse is that you begin to feel like a prisoner in your own home, planning your entire evening around bathroom accessibility. What makes this particularly challenging for seniors is that it's often dismissed as just another inevitable part of aging. Family members, and sometimes even healthcare providers, might suggest it's normal and something you'll just have to accept. But this acceptance can lead to a cascade of other problems that go far beyond the inconvenience of interrupted sleep. The truth is, while some changes in bladder function are common as we age, the severity and frequency that many seniors experience is not inevitable and can often be significantly improved. The physical toll is immediate and noticeable. When you're not getting continuous restorative sleep, your body can't properly repair itself. Your immune system weakens, making you more susceptible to infections and illnesses. Your energy levels plummet, making daily activities feel exhausting. Simple tasks that you once handled with ease become overwhelming challenges. You might find yourself needing afternoon naps just to function, which can then interfere with your nighttime sleep, creating yet another vicious cycle. The safety concerns are equally serious and often underestimated. Navigating to the bathroom in the dark, especially multiple times per night, significantly increases the risk of falls. Many seniors have experienced near misses or actual falls during these nighttime journeys. The urgency you feel can make you rush, increasing the likelihood of accidents. The fear of falling can create additional anxiety, making it even harder to relax and return to sleep after each bathroom visit. Perhaps most concerning is how this condition affects mental and emotional well-being. The constant sleep disruption can lead to irritability, depression, and anxiety. Many seniors report feeling frustrated and helpless, wondering if this is simply their new reality. The anticipation of waking up multiple times can create sleep anxiety, where the worry about interrupted sleep actually makes it harder to fall asleep in the first place. You might find yourself lying awake, dreading the next interruption. The social impact shouldn't be underestimated either. Seniors may avoid social activities, travel, or overnight visits with family because they're embarrassed about their nighttime bathroom needs. This isolation can lead to loneliness and a decreased quality of life, creating a cycle where physical symptoms contribute to emotional distress, which in turn can worsen the physical symptoms. Many people stop enjoying activities they once loved, simply because they're too tired or too worried about bathroom access. Understanding why nighttime urination becomes such a persistent problem for seniors requires looking at the complex changes happening in your body as you age. While it's true that some bladder changes are normal, the severity that disrupts your sleep night after night isn't something you should simply accept as unavoidable. Your bladder is essentially a muscle that stores urine and contracts to empty itself. As we age, this muscle can become less efficient in several ways. The bladder wall may thicken, reducing its capacity to hold urine comfortably. At the same time, the muscle itself may weaken, making it harder to completely empty during each bathroom visit. This combination means you're storing less urine, but also not emptying completely, creating a cycle where you need to urinate more frequently. Your kidneys also play a crucial role in this process, and they change with age too. Throughout your life, your kidneys have been filtering waste and excess fluid from your blood. In younger years, this process naturally slows down at night, allowing you to sleep for longer periods without needing to urinate. However, as you age, this natural rhythm can become disrupted. Your kidneys may continue producing urine at a steady rate throughout the night, or they may actually increase production during evening hours. Hormonal changes add another layer of complexity to this issue. Your body produces a hormone called antidiuretic hormone, or ADH, which helps regulate urine production. This hormone naturally increases at night, signaling your kidneys to produce less urine so you can sleep uninterrupted. As you age, your body may produce less of this hormone, or your kidneys may become less responsive to it. This means your urine production continues at daytime levels even when you're trying to sleep. The prostate gland in men adds another dimension to nighttime urination issues. As men age, the prostate typically enlarges, which can partially block the urethra and make it more difficult to empty the bladder completely. This doesn't just affect daytime urination, it can significantly impact nighttime patterns as well. Even a partially full bladder can trigger the urge to urinate, leading to multiple nighttime awakenings. For women, hormonal changes during and after menopause can affect bladder function. The decrease in estrogen can lead to changes in the bladder and urethra tissues, making them less elastic and potentially more sensitive. This can result in feeling the need to urinate even when the bladder isn't completely full. Sleep patterns themselves change with age, and this can make nighttime urination more problematic. Older adults often experience lighter sleep and more frequent awakenings. When you're already sleeping more lightly, the sensation of a filling bladder is more likely to wake you up. Additionally, once you're awake, it becomes much harder to ignore the urge to urinate, even if your bladder isn't completely full. Medications commonly prescribed to seniors can also contribute to nighttime urination. Diuretics, often called water pills, are designed to help your body eliminate excess fluid, but they can increase urine production. Blood pressure medications, heart medications, and even some antidepressants can affect bladder function or sleep patterns in ways that contribute to nighttime urination issues. The physical and emotional toll of waking up multiple times each night to urinate extends far beyond the obvious inconvenience of interrupted sleep. For seniors, this condition creates a domino effect that impacts virtually every aspect of daily life, often in ways that aren't immediately obvious but become increasingly problematic over time. Sleep deprivation from frequent nighttime awakenings affects your body's ability to heal and regenerate. During deep sleep, your body releases growth hormones that help repair tissues, strengthen your immune system, and consolidate memories. When this process is repeatedly interrupted, your body struggles to maintain optimal health. You may notice that minor cuts and bruises take longer to heal, or that you seem to catch every cold or flu that goes around. Your blood pressure may become harder to control, and if you have diabetes, you might find it more challenging to manage your blood sugar levels. The cognitive effects of chronic sleep disruption are particularly concerning for seniors. Poor sleep quality can lead to difficulty concentrating, memory problems, and slower reaction times. You might find yourself forgetting appointments, misplacing items, or struggling to follow conversations. These cognitive changes can be frightening, especially when you're already concerned about age-related memory changes. The constant fatigue makes it harder to engage in mental activities that keep your mind sharp, creating a cycle where poor sleep leads to reduced mental stimulation, which can further impact cognitive function. Physically, the exhaustion from interrupted sleep affects your balance, coordination, and overall mobility. You may feel unsteady on your feet, especially during those nighttime trips to the bathroom. This increases your risk of falls, which can have devastating consequences for seniors. The fear of falling can lead to reduced physical activity during the day, which ironically can make sleep problems worse and contribute to muscle weakness and bone loss. The emotional impact of chronic sleep disruption often catches people off guard. Many seniors report feeling irritable, anxious, or depressed when dealing with persistent nighttime urination. The anticipation of another sleepless night can create a sense of dread as bedtime approaches. You might find yourself becoming short-tempered with family members or losing interest in activities you once enjoyed. This isn't simply about being tired. It's about feeling like you've lost control over something as basic as sleep. The social consequences can be equally devastating. Many seniors begin declining invitations to stay overnight with family or friends because they're embarrassed about their nighttime bathroom needs. Travel becomes stressful as you worry about unfamiliar bathroom locations and the potential for accidents. Some people even avoid drinking fluids in social situations, which can lead to dehydration and other health problems. The relationship with your partner can also suffer. If you share a bed, your frequent nighttime movements can disturb your partner's sleep as well. This can lead to tension, separate sleeping arrangements, or feelings of guilt about affecting your partner's rest. The intimacy and connection that comes from sharing peaceful sleep together can be lost. Perhaps most troubling is the sense of helplessness that many seniors develop. When healthcare providers suggest this is just part of aging, or when family members dismiss it as normal, you may begin to feel like you're complaining about something trivial. This can lead to isolation and a reluctance to seek help, even when effective solutions exist. When it comes to nighttime urination in seniors, there's an overwhelming amount of misinformation and outdated beliefs that can actually make the problem worse. Let's address some of the most common myths that might be preventing you from finding real solutions. The biggest myth is that frequent nighttime urination is simply an inevitable part of aging that you must accept. While it's true that some bladder changes occur with age, the severity that disrupts your sleep multiple times each night is not normal or unavoidable. Many seniors resign themselves to this condition unnecessarily, missing out on treatments and lifestyle changes that could significantly improve their quality of life. Another harmful myth is that you should restrict fluid intake throughout the day to reduce nighttime urination. This approach often backfires because dehydration can actually irritate your bladder and make symptoms worse. When you're dehydrated, your urine becomes more concentrated, which can trigger stronger urges to urinate. Additionally, severe fluid restriction can lead to other health problems like kidney stones, urinary tract infections, and dangerous dehydration. Many people believe that all liquids affect nighttime urination equally, but this isn't true. While timing matters, the type of fluid you consume is just as important. Caffeine and alcohol are bladder irritants that can worsen symptoms, while plain water consumed earlier in the day is generally beneficial. The key is understanding when and what to drink, not eliminating fluids entirely. There's also a persistent belief that nighttime urination is always related to prostate problems in men. While an enlarged prostate can certainly contribute to these issues, it's not the only cause. Heart conditions, diabetes, sleep disorders, and even certain medications can all play a role. Focusing exclusively on prostate health might cause you to miss other important factors contributing to your symptoms. Some seniors think that using the bathroom right before bed will prevent nighttime awakenings, but this strategy alone is rarely sufficient. Your body continues producing urine throughout the night, and emptying your bladder at bedtime doesn't address the underlying causes of excessive nighttime urine production. A particularly dangerous myth is that over-the-counter sleep aids will solve the problem by helping you sleep through the urge to urinate. These medications can actually increase confusion and fall risk in seniors, and they don't address the root cause of the problem. Ignoring your body's signals to urinate can lead to accidents, urinary tract infections, and other complications. Finally, many people believe that surgery is the only effective treatment for nighttime urination. While surgical options exist for certain conditions, most cases can be significantly improved through lifestyle modifications, behavioral changes, and other non-invasive approaches. Surgery should typically be considered only after other treatments have been tried and proven ineffective. The good news is that there are numerous practical, safe, and effective strategies that can significantly reduce nighttime urination for seniors. These solutions focus on addressing the root causes rather than just managing symptoms, and most can be implemented starting today without any special equipment or medical procedures. Let's start with fluid management, which is often the most impactful change you can make. Instead of restricting fluids throughout the day, focus on timing your intake strategically. Aim to consume most of your daily fluids during the morning and early afternoon hours. Try to have your last significant fluid intake about 3 hours before bedtime. This gives your body time to process the liquids and reduce the amount of urine produced during sleep hours. However, don't completely eliminate evening fluids, as this can lead to dehydration. A small sip of water to take evening medications is perfectly fine. Pay attention to the types of beverages you consume, especially in the afternoon and evening. Caffeine is a diuretic and bladder irritant that can worsen nighttime urination. This includes coffee, tea, chocolate, and many sodas. Alcohol is equally problematic as it not only increases urine production, but also disrupts sleep quality. If you enjoy these beverages, try to consume them earlier in the day and switch to water or herbal teas in the evening. Dietary changes can also make a significant difference. Certain foods act as bladder irritants and can increase urgency and frequency. Spicy foods, citrus fruits, tomatoes, and artificial sweeteners are common culprits. Keep a food diary to identify which foods might be triggering your symptoms. Reducing sodium intake can also help, as excess salt causes your body to retain fluid during the day and release it at night. Bladder training is a highly effective technique that can help you regain control over your urination patterns. This involves gradually increasing the time between bathroom visits during the day. Start by delaying urination for just 5 minutes when you first feel the urge, then gradually work up to longer intervals. This helps retrain your bladder to hold more urine and reduces the frequency of urges. Practice relaxation techniques like deep breathing when you feel the urge to urinate, as anxiety can make symptoms worse. Double voiding is another simple technique that can help ensure you empty your bladder completely. After you finish urinating, wait a few seconds, then try to urinate again. This helps empty any remaining urine and can reduce the frequency of nighttime awakenings. Some people find it helpful to lean slightly forward or gently press on their lower abdomen to encourage complete emptying. Regular physical activity plays a crucial role in managing nighttime urination. Exercise helps regulate fluid balance in your body and can improve sleep quality. However, avoid vigorous exercise close to bedtime, as this can be stimulating and make it harder to fall asleep. Gentle activities like walking, swimming, or yoga are particularly beneficial. Pelvic floor exercises, also known as Kegel exercises, can strengthen the muscles that control urination and improve bladder function. Creating an optimal sleep environment can also reduce nighttime disruptions. Keep your bedroom cool, dark, and quiet. Use a nightlight to safely navigate to the bathroom without fully waking up. Consider keeping a bedside commode or urinal nearby if mobility is an issue, as this can reduce the distance you need to travel and help you return to sleep more quickly. Leg elevation during the evening can help reduce nighttime urine production. When you sit or lie down for extended periods, fluid can accumulate in your legs. Elevating your legs for 30 minutes in the evening before bedtime can help your body process this fluid before you sleep. This is particularly helpful if you have heart problems or circulation issues. Review your medications with your healthcare provider, as some may be contributing to nighttime urination. If you take diuretics, ask about timing them earlier in the day. Some medications can be switched to alternatives that don't affect bladder function as much. Never stop or change medications without medical supervision, but having an informed conversation with your doctor can lead to helpful adjustments. You deserve to sleep peacefully through the night. You deserve to wake up refreshed and energized, ready to embrace each day with confidence and vitality. The frequent nighttime trips to the bathroom that have been stealing your sleep and affecting your quality of life are not a sentence you have to accept simply because of your age. Throughout this video, we've explored how nighttime urination affects millions of seniors, but more importantly, we've discovered that there are real, practical solutions within your reach. The strategies we've discussed aren't complicated medical procedures or expensive treatments. They're simple, evidence-based approaches that you can start implementing today, and many people begin seeing improvements within just a few weeks. Remember that aging doesn't mean giving up on comfort, dignity, or quality sleep. Every night that you sleep through without interruption is a victory. Every morning that you wake up feeling rested instead of exhausted is a step toward reclaiming your life. The small changes you make today in your fluid intake, diet, exercise routine, and evening habits can have profound effects on your overall well-being. It's important to be patient with yourself as you implement these changes. Your body may take some time to adjust to new routines, and you might not see immediate results. Some strategies will work better for you than others, and that's perfectly normal. The key is to remain consistent and give each approach a fair chance to work. Keep a simple diary of your symptoms and the changes you're making so you can identify what's most effective for your particular situation. Don't let embarrassment prevent you from seeking additional help if you need it. Healthcare providers are familiar with these issues and can offer additional treatments if lifestyle changes aren't enough. There's absolutely nothing shameful about wanting to improve your sleep and quality of life. You've spent decades taking care of others, and now it's time to prioritize your own health and comfort. Share what you've learned with friends and family members who might be struggling with similar issues. Often, people suffer in silence, thinking they're alone in their experience. By opening up about your own journey toward better sleep, you might help someone else find relief too. There's strength in knowing you're not alone and that solutions exist. Your sleep matters. Your comfort matters. Your quality of life matters. You have the power to make changes that can transform your nights from restless and interrupted to peaceful and restorative. The tools and knowledge you need are now in your hands, and the decision to take action is yours. If this video has been helpful to you, I encourage you to subscribe to our channel for more practical health information designed specifically for seniors. We're committed to providing you with evidence-based solutions that respect your intelligence and address your real concerns. Please take a moment to comment below and let us know where you're watching from. Your engagement helps us reach more people who need this information. Most importantly, share this video with anyone in your life who might benefit from these strategies. Whether it's a spouse, friend, family member, or neighbor, you never know who might be struggling with sleep disruption and nighttime urination. Together, we can help more seniors reclaim their nights and wake up to brighter, more energetic days. Your journey to better sleep starts now.